Welcome back to our third micro lecture of the module. This micro lecture will focus on alcohol dependence and what long-term use looks like. Let's go ahead and get started. As you probably know, alcoholism is a serious and prominent condition throughout the United States. There are roughly 12.5 million individuals who are struggling with alcohol dependence in the U.S. at any given time. In general, men are more likely to become alcoholics rather than women, but women are increasing their numbers. Of all the drug dependencies out there, we know that alcohol relapse is likely to happen. Research suggests that nearly every single person with dependence issues will relapse or will strongly consider relapsing at some point. Many individuals will relapse several times before sobriety actually sticks. Others may never be able to achieve sobriety. For many alcohol-dependent users, the use of community and support systems is key to making it through the withdrawal and sobriety process. Groups like AA, or Alcoholics Anonymous, are strongly encouraged for those individuals who are struggling with alcohol use. The use of a sponsor is encouraged, and these programs are prepared for relapse, as it is not unusual for it to occur. Recovery from alcoholism is a long-term process where stumbling blocks are expected. In addition to the social support that so many recovering alcoholics need, there are some individuals that may need pharmaceutical support in order to help with the withdrawal process. Sometimes the withdrawal process can be so extreme that individuals risk severe side effects, including stroke, heart attack, or even death. One of the most commonly used withdrawal drugs is called antabuse. This one has been decreasing in use in the last few years, but it is still a very common medication. When the user takes antabuse and then decides to have a drink, they will start experiencing flushing, meaning a warmth or redness or a tingling feeling all over, sweating, increased thirst, swelling, rapid weight gain, nausea, severe vomiting, neck pain, throbbing headache, blurred vision, chest pain, shortness of breath, even just with mild exertion, a fast or pounding heartbeat or a fluttering in your chest, confusion, weakness, spinning sensations. They might feel unsteady or a lightheaded feeling, almost like you're going to pass out. So what does that sound like? A hangover, almost an instant hangover. Basically, antabuse blocks part of the metabolism process of alcohol, creating instantly unpleasant feelings. It makes the user want to stop drinking as these feelings start to occur after the first drink post-antabuse. Just like anything else that we do to our bodies, there is a certain element of genetics at play. Think about things like eating. Some people can eat and eat and eat and never gain any weight. Others look at a loaf of bread and gain a pound or two. There are differences in our genes that affect our weight, our predisposition to certain cancers, and other illnesses. Alcoholism is no different. Alcoholism is among the most inherited mental illnesses. If you have a parent who is an alcoholic, the likelihood of you developing alcoholism is higher than someone who was not born to an alcoholic. It does not automatically mean that you will become one as well, but you have a better shot when you are using alcohol compared to someone who did not have alcoholic parents. There are both genetic and environmental concerns at play here. Genetics are influential in things like excessive consumption. Some individuals can consume more alcohol than others without getting sick. Some can consume more than others without becoming dependent, or dependence may become delayed. They might also experience diminished negative feedback, meaning that my body does not register that I am as drunk as I really am, or that my body does not register that I am consuming a dangerous amount of alcohol. Chronic users might experience enhanced senses of pleasure and diminished hangovers. For some, the hangovers aren't as bad as they would be for other individuals. However, environment is just as important as genetics. While genetics do play a prominent role, they are not a guarantee that alcoholism will occur in our children or grandchildren. The same way that diabetes or other diseases are not a guarantee to be inherited despite having the markers for it. To conclude this micro lecture, let's spend some time focusing on the different organ systems and how they are impacted by long-term alcohol use. First, as you can see on the screen, the brain and the nervous system are impacted long-term. Everything is depressed, as we've been saying. The brain scan on the left is that of an alcoholic, and the brain on the right is that of a non-alcoholic. You can see that the areas are lit up that have been impacted by long-term alcohol use. We've already briefly discussed the liver, but long-term alcohol use will result in a hepatotoxic effect created within the liver. The hepatotoxic effect results in enlarged and fatty livers after drinking multiple drinks per day over a period of several days. It can be reversible once the consumption ends. However, if the individual does not stop, then the next stage is alcoholic hepatitis, meaning that the fat cells keep growing because the consumption does not end. This can result in chronic inflammation of the liver, but still is reversible if the drinker stops drinking. The user might experience jaundice, rashes, and outward symptoms that the liver is not functioning correctly. The final stage is called cirrhosis, which is not reversible and is demonstrated by the liver on the right side of your screen. Basically, your liver starts to grow scar tissue, and once you have more scar tissue than active, healthy liver cells, your liver stops being able to metabolize things. This can be fatal, and users often need a liver transplant with a piece of a healthy liver. However, for most transplant recipients, they would not be eligible for the transplant list as they have contributed to the demise of their own liver. Yet, if there is a family member or a friend who is a match, then they are able to receive a portion of the donor liver from that person. If you didn't know, the liver is like a starfish. You can cut a piece off and your liver will regenerate. The recipient who receives a portion of your liver will also begin to have that liver regenerate once the body accepts the transplant. While waiting for a liver transplant, the individual in question will have to receive dialysis to make sure that their liver is at least functioning somewhat. You also might see blood problems popping up when there is a large amount of alcohol consumption over a long period of time. There is a decrease in the production of red blood cells, white blood cells, and platelets. Individuals might have problems with clotting and immunity to infection. Essentially, you're thinning your blood, so if you cut yourself, you will bleed for longer. Because you're thinning your own blood, you will need help to be able to create clots again. Things like Coumadin are prescribed for blood clotting issues, but that prescription almost always requires you to stop drinking, something that is very problematic for alcoholics. Chronic alcohol users also start to have heart issues. This is due to the dilation of blood vessels that is occurring. Have you ever seen someone with a red nose or broken blood vessels in their face? This is because of the alcohol use and the effects it has on the heart. Alcoholic cardiomyopathy is also possible. This suggests congestive heart failure due to the replacement of heart muscles with fat and fiber because of the drinking. The more you drink, the more fatty tissue overtakes your heart muscle and basically enlarges it. The heart cannot function in the same way that it used to, so it is struggling to pump blood normally. This can result in an irregular heartbeat or arrhythmia, or even a massive coronary heart attack. Finally, we also see the effects on our sexual organs, which is the ultimate irony regarding alcoholic endeavors. Most people who drink for a long period of time normally want to have sex at the end of the night or go to bars for that purpose. However, the more you drink, specifically with men, the less likely that it is that you will be able to have sex. Men often experience an inability to maintain an erection, a lowered sperm count, and or diminished hormones in the blood. On that note, this ends our third micro lecture on alcohol for the module. In the past, I would traditionally cover alcohol for 2 modules in total. But as we are trying to focus more on program development and the regulation of substances, I am going to end the alcohol lectures here. I still want to give you as much information as possible, so I have included a YouTube link to an older lecture focused on the behavioral aspects of alcohol consumption. This is an optional lecture and is not required, but it is there if you'd like to learn more about the topic. In our next module, we're going to begin a 5-week discussion on marijuana legalization, the war on drugs, drug courts, and other efforts to help curtail the drug epidemics in our country. Join me back here next time for the start of that discussion.